Person who is 45 years of age looks like he's 60 years old. You're injuring your foot. It means that you're going in for diabetic foot. The sensation in the foot is lost. So their sense of pain is lost. Their sense of pressure is lost. And their sense of temperature is lost. That happens, then there's a danger that he loses his leg. Because the leg itself can become gangrenous.
You are watching Surgery Simplified, shastrakalasaralshabdomein.
Where is Aishwarya? Vinay? Shirish? Where is she? Oh, Aishwarya, what are you doing there?
Oh, I'm so sorry. I'm
You
so
have a show to
sorry,
do.
doctor. I actually got so much engrossed with the book, the diagrams and the pictures that I totally forgot. Oh my god, this is so heavy. Anyway, welcome, doctor.
Thank you.
Hi there, hello everyone. Welcome to Surgery Simplified, shastrakalasaralshabdomein. Doctor, मैं आपका obviously आपने देख लिया होगा. I was just going through the book and I thought maybe I'll decide for just once कि आज topic क्या होगा. So I was just going through and maybe let's talk about the non-healing wounds on the legs.
Okay.
I found that very interesting to know more about.
Yes. So that's again one of the common conditions that we do see in today's practice. Why do I say today's practice? Because the commonest cause for a non-healing wound anywhere in the body, but particularly in the foot, is uncontrolled diabetes.
Okay.
And we have a virtual epidemic of diabetes in the country. As a result of not being controlled, the diabetes, one of the complications of diabetes is what we call diabetic foot.
Diabetic foot.
And it is one of the common complications seen in people who have a long-standing diabetes and which has not been controlled properly since a long time. The other cause, which is less common, but again not uncommon, is ulcers that develop because of varicose veins. So we call them venous ulcers. So we'll discuss both these non-healing wounds. The one being wounds that happen in diabetic foot and the wounds or ulcers that happen in varicose veins. So let us start with diabetes. So basically what happens in diabetes is the process of aging is accelerated.
Acha.
Okay. If you, I don't know if you have heard this term biological age.
Biological age. No,
Yeah. So basically there is what is called as 3 ages. One is the chronological age.
हमारा regular life.
That is the age which is determined by a birth certificate.
Acha. Okay. Got it.
Okay. So for example, a person is 45 years old as per his chronological age. Biological age is how fit is his body. So you can see that some people you will find marathon jab hota hai, that there's an 80-year-old guy who's running a marathon.
Right.
Now his 80 years is his chronological age, but his biological age is like a 60-year-old because he's capable of running a marathon at the age of 80.
Correct.
So that's the biological age. What happens in a diabetic is because of uncontrolled diabetes, there is pre-senile aging. Pre-senile means aging starts earlier than in people. And over a period of time, they could age so much faster that their lifespan is reduced by as much as 10 to 15 years.
Oh, okay.
Yes. So a person who is 45 years of age looks like he's 60 years old.
Got it.
It's the opposite. There you have an 80-year-old man who's running like a 60-year-old. Here you have a 45-year-old looks like a 60-year-old. So one of the main thing that happens in diabetes is the blood vessels harden with age. Right? It's called atherosclerosis. Everybody knows about it. That blood vessels harden. So if you consider that the heart is like a root and there is a tree and all the branches. So from there the whole branches of blood vessels go to all the parts of the body. So we have what is known as terminal branches of the tree. So there are 3 organs which have these branches ending there. So they are known as end arteries. Can't go beyond that. In the foot,
Correct, absolutely.
in the eye, and in the heart itself, and in the kidney. So these are 4 organs which are affected by diabetes. So you get retinopathy or some problem with the retina, which is the inner lining of the eye, nephropathy or diabetes induced kidney failure, heart attacks, and diabetic foot. Okay, so the basic pathology over here is less circulation. Second thing is sugar is there in the blood. Sugar is a good medium for infection.
Right.
So when there is any kind of injury, like when they are walking, they hit something and cause a small wound, or their shoes are very tight and there is a shoe bite, that wound allows bacteria to enter. Blood has sugar in it, so the bacteria start growing, the ulcer becomes bigger. He doesn't care about it in the beginning. By the time he realizes that this is a non-healing wound, it is already 1 month, 2 months and the wound has become big.
Okay.
There's swelling all around, which you call as cellulitis. The leg becomes red in color. Okay. And one more thing that happens along with the reduced circulation in diabetic foot is the nerves which go to the foot or anywhere in the body. They have blood vessels also. The nerves need blood vessels, which is called vasa, means blood, nervorum. That means there are very tiny blood vessels which feed each nerve. These tiny vessels also get blocked, so the nerves die.
Achha.
So they get neuropathy. That means diabetic neuropathy means that the sensation in the foot is lost. So their sense of pain is lost, their sense of pressure is lost, and their sense of temperature is lost. So they don't understand, like if I am going in a hot sand, I will not be able to go because of the heat.
Correct.
They will walk, and because of
they
the
don't have
heat
any
the
sense.
skin will burn, because they don't have sense of heat of both pain, heat and sensation, or they don't have sense of pressure. So they tend to put more pressure to feel the earth, and that's why if there is a stone something, they get injured. So the mechanism of injury arises from the diabetic foot itself, because of less blood supply, because of blood in the sugar being high, which will perpetuate infection, and because the nerves are not functioning properly. The third thing that happens in these people is that because the nerves are not working, if you see the foot, it's got an arch.
Okay.
If you see a footprint, it will be like this. It will be not flat, right? You will have, if you put your foot in water and keep it on a dry area, you will get, it's like a question mark.
Correct.
It's like a question mark. There's hollow in between because there's an arch. So this transverse, lateral and the heel is where the weight is on the foot. Now when the nerves are affected, the small muscles in the foot which maintain this arch, they get paralyzed. So the arch is lost.
And you get a flat foot.
You get a flat foot. And these areas which are normally not supposed to take weight, they tend to take weight. And therefore because of too much of weight on those areas of the foot which are not meant to take weight, they get callous. Callous means thickened. That skin becomes thickened. If you see a cricketer, you will find that some callus is there on where the bat handle is there. Or if you see a karate guy who is doing on the knuckles, you will find callus. So you will get callus on the foot. Now the callus is unhealthy skin, and it acts like a hard area which presses on the inner area of the foot, and you can get ulcers or wounds when the callus comes off and the wound gets infected. And this keeps happening because unless you give special footwear to redistribute the weight, only treating the ulcer will not help.
Got it.
So how do we treat these kind of patients? The first thing is we have to treat it along with the diabetologist colleagues. They will control the diabetes while we treat the foot.
Okay.
Okay, because it is very important that the diabetes has to be controlled along with the treatment. Now, if there is pus somewhere, we need a surgery to do pus, remove the pus. If there is dead tissue, we call it debridement. That means removal of the dead tissue.
Acha.
So we try to get good circulation there. We also give tablets like aspirin and pentoxifylline or Trental. These are medicines which improve circulation. Okay, which you take even after heart attack and all. People are given aspirin. So we put the patient on aspirin, put the patient on pentoxifylline, put the patient on antibiotics. After seeing what kind of pus is there, do a pus culture. We do debridement of the foot, and we wait for the wound to heal. If the wound does not heal, then the option is to do skin grafting. You remove the skin from here, put it over there. Or you can use a flap, local flap. That means you raise a flap, take a part of the foot of the area from nearby and take it there and suture it there. And then put a skin graft here. This area is better to heal than that. That means you take a area from the calf and turn it around and put it on the heel or on the lower part of the foot which is bearing weight, and that place where you remove the skin, you take the skin from here and put it there. So the whole thing is basically to do reconstruction of the wound, either with the help of a direct skin graft or with the help of a local flap. So this is a multidisciplinary treatment.
Understood.
It will involve treatment of the diabetes, it will involve improvement of circulation, it will involve giving specialized footwear, and it will involve some kind of surgery, reconstructive surgery. There is one more thing is that if the circulation of the larger vessels, that means near the knee joint, if they are involved, then you could also involve a vascular surgeon to improve the vascular, vessels. That means direct surgery on the vessels to make them, remove the atherosclerotic plaque and or use a vein to bypass from the higher vessel to the lower vessel, so that this vessel, like you do a bypass in the heart, bypass, bypass the blocked vessel. So if this vessel is blocked, because if that happens, then there is a danger that he will lose his leg. Because the leg itself can become gangrenous.
Okay.
So diabetic foot itself has now become a subspecialty because it is so frequent, and each diabetic foot patient has different needs. You can't have one solution for everything. So basic thing, again I come to take home message, please control diabetes. If you are not having controlled diabetes and if you feel that you are injuring your foot, it means that you are going in for diabetic foot. Go in and meet a surgeon. Use protective footwear. Do not neglect any wound that happens in the foot or anywhere, especially in diabetics. Before it becomes bad, consult a surgeon so that it can be nipped in the bud. But the bottom line is that you need to control diabetes.
So do you have any quick tip on how to control diabetic? I mean,
eat less, exercise more.
All right.
Intermittent fasting does help. So even if you don't want to do a perfect diet, because it's difficult to do it all your life, you should eat in an 8-hour window and 16 hours you don't eat. So 12 o'clock to 7 o'clock is the window when you can eat. And from 7 in the evening to next day 12 in the morning, you cannot eat anything. You can drink water, you can drink green tea without milk or sugar, you can drink black coffee.
Okay.
Only these 3 things are allowed. If you do this, it has been proven to help to control the diabetes to a large extent. So you don't have to worry about what do I want to eat. Obviously, even in that 7-hour period, if you can avoid sweets, you can avoid oily things, you can avoid pizza, burger, it is good. But it is not that important as it would be if you are eating throughout the life, throughout the day. You are going to keep fasting for 16 hours, the blood sugar will come down to a very low level for those 16 hours. So that is good enough to control the diabetes.
All right, wonderful. So this is one part of our session for this episode. and please stay tuned for the other one. If you have any questions for this one, please put it on the comment section and we'll get back to you. Hit our video like, share and subscribe and hit the bell icon for notification. Thank you.
Thank you.